Good morning. I'm Carol Dixon with the Idaho Federation of Families for Children's Mental Health, and I'd like to welcome you to our September webinar. And we were just saying that it's amazing that it's September. Once again, summer has flown by. So we are now into our fall series, and today we're going to have a discussion. We are going to have a discussion on neurofeedback. And I'm really excited to introduce you both to Linda Miller, who is a parent who has children that have mental health challenges, and she's also very involved in the YES Project, Youth Empowerment Services, which is the new children's mental health system of care. So she is one of the parents who has really gotten involved and is participating kind of in the design of the program and how it rolls out and making sure that it is family friendly, I guess is the best way to explain it. We also have Dr. Barbara Minton, who is here in Boise, and she is from, well, she's from Boise, but was in Alaska for about 12 years. Am I correct on that? Graduated from the University of Denver prior to that. And in about 2012 started working with biofeedback and has really developed a practice that has been very beneficial to the community. So she's going to spend some time explaining that and really answering the questions that a parent would have of how does this work? You know, would it work for my child? What does it look like? So with that, I'm going to turn it over to them. We appreciate both of your being here, and I'm excited to learn what you have to share.
Thank you. Okay, so what is neurofeedback? Let me see if I can get the PowerPoint up here. Yeah, I need the PowerPoint. So there we go. What is neurofeedback? Neurofeedback is EEG biofeedback. So if you know what biofeedback is, then you'll know a little bit about neurofeedback. If you don't know what biofeedback is, that's fine, because we'll talk a little bit about that here. So let me show you. I'm first going to talk a little bit about the history of neurofeedback, if I can get this PowerPoint to actually go forward. Let's try again. Well, let's see. I need some little technical help there. Can someone advance the PowerPoint for me, please? You want to try?
Yeah, maybe I have a better angle.
Maybe you do. Nope. Well, I'm going to go ahead and start talking about it, and we'll let the pictures catch up with this later. So I want to actually start. Oh, there you go. Go back. There we go. So Hans Berger was the first guy who discovered EEG. And what is EEG? Well, EEG is made from the brain. We all have neurons in our brain. Neurons are special cells. These neurons fire and create electricity. And Hans Berger got interested in this because way back in around 1892, I think it was, he was a young man in the military in Germany. And he was driving one of these artillery wagons, riding a horse. The horse reared. He fell off the horse onto the ground right in front of another artillery wagon that just about ran over him, and he had a complete panic attack, as you might imagine. Well, later on that day, he got a telegram from his father, and what had happened is his sister, at about that same time, had this horrible feeling that something terrible had happened to Hans. And she was 107 kilometers away, so it wasn't very close. And she ran to her father and said, "Dad, you've got to telegram and see what's going on with Hans. Something terrible has happened." Well, this changed the course of Hans Berger's life, because he was said, well, how could she possibly have known? Somehow I physiologically sent some message to her, and I have to figure out how this happened. He was very scientific. He didn't believe in ESP. He believed something physically actually came out of him, went through the air, and went into her. And he's basically spent much of the rest of his life trying to figure that out. Well, fast forward to around the 1920s, and you can see in this PowerPoint slide a little squiggly line. And what that little squiggly line is what he discovered when he put a sensor on the person's head and he got the electricity that was coming out of the top of the brain. He never did figure out, sadly for him, why his sister knew that he was in so much trouble, but he did discover EEG. So what happens is when those neurons in your brain fire in a column together of about 10,000, they make enough electricity that we can actually detect that coming out through the top of the head. And that is what EEG is based on. So EEG, the neurons in the brain actually fire in different patterns when we're doing different things. So when we're depressed, they fire in a certain pattern. When we're happy, they fire in a different pattern. When we're doing math, they fire in a different pattern. When we're singing, they fire in a different pattern. When we're giving a talk on YouTube, they fire in a different pattern. And we can actually track those patterns in the brain, and we can look at the brain and see what it is doing at any given time. So here's a little picture of a cat in a cage, and this was one of the first experiments that was done that led to neurofeedback. So Barry Stearman, who was a professor at UCLA at the time, this was in the early 70s, I believe, discovered that when he put cats in cages, and they got a little reward. So what would happen is they had, I believe it was milk and chicken broth. They wouldn't work for either of those alone, but when they were mixed together, the cats got really, really interested in those. And what would happen is the cat would have to press a bar and wait for a light or a tone to come on, and then they would get a reward. So they noticed that after a while, if they had to wait until that tone or that light came on before they pressed the bar, the cats would make a certain signal coming out of their brains. Their brains would start to fire between 12 and 15 times a second, which this later became known as sensory motor rhythm. But the cats, I'll give you my impression of the cats. The cats would sit very still, just like this. So they were calm but alert. They would wait for that tone, press the bar, and they would get their reward. So, sort of an interesting experiment. No one quite knew what to make of it. So these cats became very good at making this rhythm in their heads. And then what happened was, just sort of unrelated to this, the Mercury astronauts were flying around the world at this time. And when the Mercury astronauts were flying around the Earth, they would look down and they would say things like, "Oh, there's women down there on the South Sea Islands waving at me." And the guys at NASA would be like, something is not right here in this capsule, because you cannot see women in the South Seas Islands from a Mercury capsule flying around the Earth. And these guys were having some sort of hallucinations. So they contacted a researcher and said, "Can you please find out what happens if we expose animals to rocket fuel?" And so the person who was doing that research called Barry Stearman, who was doing the research on cats, and said, "Do you have some cats that we can use in this research?" Barry Stearman says, "Sure." So they take these cats, they expose them to rocket fuel, and this is a little map of what happened to them. So many of the cats, they would get very sick and they would vomit and they would have seizures, except for some of the cats didn't have seizures. And they were like, well, what the heck? Why are some of these cats kind of getting sick, but then they're fine, and the other cats are really getting sick and they're just totally tanking? So they went back and checked all the records, and they found out that the cats that were fine and not having seizures were actually from the previous study where they had started to make this 12 to 15 hertz rhythm. So they said, wow, these cats changed how their brain was firing, and it actually made them less reactive to these toxins, and they aren't having seizures. So the next part of the story is that there's a gal who worked in a lab by Barry Stearman's lab who had a terrible seizure disorder. She was not able to drive. Her seizures were not under control of her medication. her life was very constrained by these seizures. So she was listening to the guys talk about this research, and she said, I want you to teach me how to make that rhythm with my brain. And Barry Stearman was like, well, I'm a researcher. This isn't really research, but she finally convinced him to do this. They put a sensor on her brain, and every time her brain started to make that 12 to 15 hertz rhythm, a little green light went on. And over time, she learned to make more and more of this rhythm, and her seizures went away. And she got her driver's license, and her life was completely changed. And so this is really where neurofeedback got started, the idea that when you change your brain, you can change your life very significantly. And for her, this was huge. Meanwhile, oh boy, I cannot read that. These are a couple of studies on epilepsy, and hopefully you guys can read them. But you will see that with neurofeedback and epilepsy, some of the very first studies show that neurofeedback was quite efficacious for epilepsy. They actually found about a 61% reduction earlier when one of the first studies in seizures, but some people responded 100% to that. They actually also trained people in neurofeedback for seizures at UCLA who were waiting. Their seizures were so bad they were going to have neurosurgery to remove those parts of the brain. And none of those people who did the training went on to have the surgery. So you can imagine this was a very powerful effect. There's another person who was very influential in the beginning of neurofeedback, and this is a psychologist named Joe Kamiya, who really studied the alpha rhythm, and he's got a very interesting story about the alpha rhythm. I'm going to skip through this a little bit just in the interest of time, but I hope you'll go to YouTube. He's still alive. Both Barry Stearman and Joe Kamiya are still alive and working actively in the field. Joe Kamiya is in his mid-90s now, but he actually found that people could learn to make the alpha rhythm on command. So he could tell someone in his lab, after they practiced a little bit, make alpha, and they would make alpha. And then he would say, don't make alpha, and they could stop making alpha. And so the idea that we could get control of what our brain is doing when we had feedback about what it was doing became really the essence of what neurofeedback is about. All right, there's a little shot of Joe Kamiya. You can actually download, and this is him giving the talk a few years ago. You can download this on YouTube. He's also got, just as an aside, another very interesting YouTube video about being in the Japanese internment camps in World War II and the effect that had on him, which is great. So alpha theta neurofeedback came out of some of the work that Joe Kamiya did, and this work was done at Mayo Clinic in the early 90s, and what they found is that when they taught people who had alcoholism, who were in inpatient alcohol treatment, when they taught those people to make more alpha and theta in their brains, that their rates of people who came back to treatment as treatment failures just plummeted. So their rate went from about 20% success to about 80% success when they added neurofeedback into their treatment program. And what they were really came to in the end about this is that that many people who had alcohol and addiction issues were actually trying to normalize their brain by bringing these substances in. And when they looked at their brains actually weren't making enough alpha, and when they drank, their brains would make more alpha, so of course you would want to drink. If you can teach your brain to make alpha without that substance, then the probability of you using that substance goes way down. And there's very interesting stories about this where people would just say, well, I just forgot about drinking, or I actually drank this and the glass of wine just tasted horrible. Some people actually got an aversion to alcohol as they were doing this study. So that's a little bit of the background of neurofeedback. Let's talk about how many people are practicing neurofeedback today, unless you have any questions.
I'm going to have questions about how it's practiced for children.
Okay.
So I know you'll be getting to that.
We are
So,
getting
yeah.
to that. So here we go. So one of the things that we do is when we do neurofeedback, we put a cap, which we'll have a little video of in a minute, a cap on people's head that has 19 sensors in it. Those sensors pick up the electricity that's coming right out of the head. We do not put anything into the head in neurofeedback at all. We only detect what is coming out of the head. So here's an example of someone who has anxiety, and I'm going to tell you just what these maps are. So the top line is all the same person, and if you look across, the waves are the different waves that the brain makes. So I'll quickly talk about these. You don't really need to remember or understand them. You just need to get the main idea here. So on the far left is delta, that's a sleep wave. The one next to it is theta, which is kind of a wave we make as we're falling asleep. Alpha is that Zen calming wave. Beta is that kind of bright-eyed, bushy-tailed wave when you're just on and taking notes in class and remembering everything the teacher says. And high beta is a very fast wave that people make when they're inventing the cure for cancer or when they're very anxious. And so if you just look across that top line, you can see here that alpha is a different color than the other waves. So green means those waves are in the normal range. Blue means there's not enough of those waves, and yellow means there's too much of those waves. So when we looked at this person, what we saw is they were not making very much alpha, which is that Zen calming wave, and they were making too much high beta. You can see that orange there, which is that wave that's associated with anxiety. So when you say, well, how do we want to train this person? We want them to make more alpha, because if you're anxious and you can make more calming waves, you're going to feel better. We want them to make less high beta so that their brain isn't operating so fast and making them feel so anxious. And then if you look at the bottom line, you can see actually that that alpha is a little bit greener than it was. So this is after, 30 or 40 sessions of training. Their brain is actually making more alpha. They feel much better. They're still making a little bit of excess high beta, but they're fine. They're calm. So they go out the door and they're happy. Let me show you one more, and then I'm going to actually show a little video of what happens in a neurofeedback session so you get an idea of what is causing the changes in these maps. Let's see. Let's go forward here. Okay, that's just a different configuration of anxiety where you can see a lot of excess high beta. This person made plenty of alpha, but they had way too much high beta, and you can see as that high beta calmed down and got better on the lower set of maps, they ended up feeling much better. Here's an example of someone with attention issues who's been diagnosed with ADHD. And on the top, what you can see is they're making a lot of excess slow waves. So they're making too much delta and too much theta. And when you're making a lot of slow waves, your brain is very sluggish and sort of half asleep, and the teacher's talking and you're kind of drifting off and thinking about other things and what might I be having for lunch, and so this makes you very inattentive. If you look after treatment on the second set of maps, you can see that those slow waves have diminished significantly, and the person did better. They're doing great in school. Very, very good outcome for this person. So how do these changes happen? What do we actually do in a neurofeedback session? Let's see if you could run that video. So here's an example. This is Heather Dunham. Heather is one of the neurofeedback trainers that works with me, and she was so kind to volunteer to do this for us. I'm putting the cap on her. She's a licensed clinical social worker who does neurofeedback and also talk therapy here in Boise. So this is the cap. You just pull it on the head, kind of like a swim cap. You can see those little white dots are the electrodes or the sensors that are going to pick up the electricity off her brain. There's the EEG running across the screen. And what's really exciting now is that we can actually real-time image the brain. So this is her brain firing right while we are training her. So we're looking down right there on top of her brain. Green is in the normal range. Red means where her brain is really firing, and blue is where her brain is resting. And so we can actually, some people like to train with this, map and actually watch their brain really working while they're training, and that's certainly a possibility. Most people like to play the games. This is another really great thing we can do now. We can actually image internal parts of the brain, and you saw a very quick shot of that there. Here's one of the neurofeedback games. So if you came to neurofeedback, what we would do is we put that cap on you, and then you spend 20 minutes either playing a computer game, watching a movie, or doing something else. So if you ask, how do you do this with kids? You put the cap on, and then if they want to play, we have mini computer games. This is one of them. So Heather is flying this airplane with her brain. Neurofeedback is a form of brain-computer interface, and we are, as she is flying this, we are actually training about 5,500 variables in the brain. As those variables, as those parts of her brain oscillate towards normal, her plane flies better. So she is aiming, if you can see the little green circle, she aims for that green circle, and the better she does, the more successful she is at going through the circle, and the computer gives her feedback, she almost didn't make it there, but she got through the end, and she got 25 points for that.
Does she have a handheld device also?
Nope, she's all running it with her brain. So as she gets better over time, then she gets more successful at going right through the center in that game. This is an example of a video, so this is a YouTube video. If anybody likes cats, you should watch these videos called Simon's Cat. They're these little cute videos. This is one where she is actually running the brightness of this with her brain. So every time her brain oscillates towards normal, the video brightens. So you don't really have to do anything with neurofeedback. Your brain likes it when the video is brighter, and so your brain will automatically learn how to brighten that video. It's a little bit like learning how to ride a bike. So it's very difficult to tell yourself every little piece of how to ride a bike, but you get on there and try to do it, and you just are really happy when you're up there for a little bit, and then over time your brain takes account of literally thousands of variables, and all of a sudden you're riding a bike. And the same thing happens with neurofeedback, where you get on and you're like, well, what do I do? And we say, you just sit there and enjoy the video. So it's easy to do neurofeedback. It's one of the advantages for people who don't engage well in therapy or kids that are too young to engage in a therapeutic process. We can do neurofeedback with them because the demands in the moment, it's a much less, it's a very fun way of changing your brain, let's put it that way. So tell me what questions you have at this point, if any.
So how does that integrate with the work they're already doing in counseling and therapy?
It's a very good question. We think what we have experienced, because we do talk therapy, so I do psychological testing, talk therapy, and neurofeedback. And I also do neurofeedback for other people who are currently doing talk therapy with their clients. And we feel like there's a very synergistic effect between those two things. So as someone's brain becomes more self-regulated, they're more able to engage in talk therapy. And so we see them as very complementary approaches, and people who do both often make very substantial progress. The thing that neurofeedback can't do, if there's content that a person needs to talk about, so we can rehab the brain with neurofeedback, but we can't teach you how to do calculus. Right? So you still have to get the content in there through another modality. So neurofeedback often helps regulate emotions, attention, It has been used to remediate learning disabilities. You can target the parts of the brain that have learning disabilities and activate those parts of the brain. But the content really has to come from somewhere else.
So if there's some errors in thinking, they still need to fix those. If there's traumatic events they need to work through, they still need to do that work. Is that what you're saying?
I'll say yes and no. Sometimes errors in thinking fix themselves, and sometimes they don't. So we had someone come in who found that who reported to us that everything people were saying was stupid. And after they did neurofeedback, they said, well, people seem to have gotten smarter. And then she said, well, I realized it really wasn't that they got smarter. It was that I changed. So sometimes those things will self-correct, but sometimes they won't.
Yeah.
So what we see a lot, if people have very habitual coping strategies, then oftentimes that needs to be remediated with therapy. The difference is that therapy sticks a lot better if your brain can take that information in.
That
and
makes
neurofeedback
sense. Okay.
helps with that, yeah.
Where do you start? Then you start with the psychological testing, with the therapy, with the neurofeedback. Where do you start?
Well, I'm a psychologist, so I
Yeah.
have to say it depends. Right? Let's see
depends on where they're manifesting.
Where are we in the PowerPoint here? Can we get the PowerPoint back up? I want to talk a little bit about efficacy. So let me answer this question about where do we start. If someone comes in and says, my child has a diagnosis of ADHD and reactive attachment disorder, then maybe we don't need to go through that diagnostic process.
Sure.
We do the quantitative electroencephalogram, which is the QEEG, which is the brain maps you saw earlier with the little green and yellow and blue on there. So we would probably just do the quantitative EEG and start training them. If someone comes in and says, I have no idea what's going on, and my kid is doing this and that, and they're making life miserable for us, and we talk about, does it make sense to do traditional psychological testing? Does it make sense? And we really end up into a whole treatment planning process, and that process may or may not include neurofeedback and other modalities, if that sort of answers your question. Let's talk a little bit about, does neurofeedback really work? One of the things that will happen to parents and professionals about neurofeedback is right now there are many people who are concerned about neurofeedback who feel it is kind of a fake treatment and it doesn't really work. One of the very interesting things to me is that neurofeedback comes out of the research neuroscience area. It does not come out of medical areas. It does not come out of clinical psychology. So oftentimes people in those clinical fields really haven't been trained in neurofeedback. They don't know about the research in neurofeedback. So they are understandably suspicious of this modality. So I encourage you, if you are interested in neurofeedback, to learn a little bit about the research yourself so that you can be a good advocate for your child and help them get the treatments that are most appropriate and the treatments that they need. So back to the PowerPoint here. So the two areas that we have the best research on in neurofeedback are ADHD and epilepsy. We talked about epilepsy a little bit earlier. There's some really fascinating case studies about epilepsy, but I'm not going to talk about those today because I think that's probably not the area that most people are interested in. I am going to talk a little bit about the ADHD research. And the reason is that it gives a very good template to think about other areas of research in neurofeedback. So here is a meta-analysis. A meta-analysis is where they take the results of many studies and add them together to see if something works. So I think there were something like 741 kids in this study on ADHD to see, does neurofeedback work to remediate the symptoms of ADHD? I'm going to take a little segue here and talk about the idea of effect sizes. And I don't mean to intimidate anybody with statistics, but I think as a consumer, when you can start asking the right questions to your providers, it will help you be the best advocate for your kids. And if you know this concept of effect sizes, you can actually look at the literature and decide if you really want to take on that treatment for your child. So what is an effect size? I do not see my slide about that. Okay, well, I'll just describe it. So an effect size is basically, does something have a big effect, a small effect, or a medium effect? And if something has a small effect, in other words, let's say you did 700 people in a study and they got 2% better, maybe that's when you want to think about whether you really want to put your child in. If you have a medium effect size, so a small effect size would be equivalent to, say, the difference in height between a 13 and a 14-year-old girl, right? So it's a small effect size. There's something there, but there's a lot of variability. Some 14-year-olds are actually smaller than some 13-year-olds. It's not that impressive. A medium effect size, and these effect sizes are reported in numbers that go from 0 to 1. So a small effect size would be about 0.2. So if you're reading the literature and they say, oh, we found a significant difference, our effect size was 0.2 or 0.3, you're going to go, is that really worth the time and money? A medium effect size would be like the difference between a 14-year-old and an 18-year-old girl. So most of us could tell the difference in height between a 14-year-old and an 18-year-old girl. So that would be an effect size around 0.6. A large effect size, about 0.8, would be the difference between in height, say, between a 14-year-old and a 19-year-old girl. So you always want to look for at least medium to high effect sizes, at least in my opinion, in terms of treatments you're going to pursue for your kids. And let's see, I wonder if we can make that big on the screen. We can't read
from here.
From here it's hard to read. So in ADHD, I wanted to just talk about some of the effect sizes here that came out in this literature where they combined all these studies together. Can you read that? See if you have better eyes than I do.
Small effect size 0.2.
Oh, that's that's what I just said. Okay, that's the effect size one. So let's look for the effect sizes of neurofeedback on impulsivity. So if kids are impulsive, which is one of the big problems in ADHD and also in emotional dysregulation disorders, is you just, whatever is on your mind you do, or if you get upset, you do things very impulsively. So neurofeedback versus no treatment, the average effect size was, I can't quite read that, but I think it was about 0.68. It was, so there's a good medium effect size there. One of the interesting things is on impulsivity, when they compared neurofeedback with methylphenidate, which is Ritalin, the effect size was 0. Well, what does that mean? That actually means that neurofeedback had the same effect as Ritalin did on impulsivity. So the effect of neurofeedback was comparable to that of Ritalin on impulsivity. I will say one of the interesting things about neurofeedback is once you do neurofeedback, we now have 10-year follow-ups on ADHD that show that those changes hold. So once you do neurofeedback, the brain has changed, it's working better. We can talk a little bit about why do the changes hold, and that is one of the reasons people like to do it as opposed to medication regimens, is to avoid the side effects and the sort of constant need to take medications. All right, so ADHD and inattention, the average effect size on that was about 1. So this is a good effect size. People definitely became more attentive when they did neurofeedback for ADHD. Impulsivity, can you read that one? You got better eyes than I do.
0.7.
Okay, so That's a good effect size on hyperactivity. So we've talked a little bit about ADHD. Neurofeedback seems to be quite efficacious for ADHD. The changes seem to hold very well. But what about everything else that we're all concerned about? What about autism spectrum? What about anxiety? What about emotional dysregulation? What about whatever your child has been diagnosed with, or whatever your child's problems are for? Because whatever problems your child has, because it's nice, but if your kid doesn't have ADHD, it's really not relevant to you or their functioning in life. So here's what I encourage you to do. I encourage you to go to PubMed, PubMed.gov. PubMed.gov indexes all the medical literature, and you can type in neurofeedback and whatever, neurofeedback anxiety, neurofeedback reactive attachment disorder, and up will pop the studies that are related to that. So a few days ago I just typed in neurofeedback autism spectrum, and we can talk about some of these studies if you'd like, but as you become a good consumer of the literature, you can also become a better advocate and understand the treatments better. So here's a study that came up showing that neurofeedback helped the symptoms of autism spectrum disorder. I typed in neurofeedback and depression. Here's a recent study on depression. You might have seen this popping up on people's Facebook pages where it looks like neurofeedback had some efficacy with depression. Here's some on anxiety. So
what about oppositional defiance?
It's really interesting. I actually don't know of a study on that, but what is really interesting about neurofeedback is there's the traditional way of viewing diagnosis, and then there's how people in neurofeedback view it. And I have a foot in both worlds. So a traditional person says, let's figure out what the diagnostic category is this person falls in, because that's going to tell us how we should treat them, and it's going to help us understand what's going on. Neurofeedback people, as a group, tend to say, we don't really care what you call it, and because we know that the way the brain runs does not fit diagnostic categories. And if you know, the previous director of National Institute of Mental Health stood up and said, we've got to get rid of DSM-5 because it doesn't match what the brain is doing. So what a neurofeedback person might say is, if you come in with a child with oppositional defiant, we would say, let's map them and see what their brain is doing.
Sure.
And then we're going to help them regulate their brain. So we don't even care. You can call it oppositional defiant, anxiety, reactive attachment. We could care less. If we see that part of the brain that is associated with that symptom dysregulated, we want to train that, and your child is going to get better. So people who are remember that neurofeedback comes out of the neuroscience literature, not out of the clinical literature. So it's very interesting to think about the differences in these perspectives.
It sounds like they're still trying to integrate the two in the professional fields.
I think right now most clinical fields are neurofeedback is making very small roads into the clinical fields. Mm-hmm. I think most of the clinical fields are still not aware of neurofeedback or kind of ignoring what goes on there. So I don't think it's well integrated. The one area where neurofeedback is actually being more integrated is in the counseling field, because it actually came out in the world of counseling. They have tiered interventions that they recommend, and neurofeedback and biofeedback actually made it as a tier 1 intervention.
Oh, explain that to us.
It just means it's a good one.
Explain the tiers then.
Yeah, I'm not a counselor, so we'll have to get an expert in counseling in there, but the tiers are basically the interventions you want to do first on somebody because they're the most efficacious interventions. So you want to consider those interventions before you consider some that are down the line. Okay. That's kind of the generic version of it, yeah.
Okay. So how does neurofeedback compare with other interventions like EMDR, and I can't think of any other ones.
Well, there's
brain balance would be another one.
Fill in the blank, right?
Yeah.
The short answer to that is we don't know.
Okay.
The reason is that we don't have double-blinded, multi-site, placebo-controlled, vetted studies saying across the country we assign all these kids to this one and we won't give them anything else. And then we'll assign another group to that one and we won't give them anything else. So these studies will probably never happen. One is for ethical reasons, because depriving children of treatment that we think have some efficacy is always questionable.
Yeah.
But I think the other one is that there isn't a big, so the pharmacological interventions have big industries behind them that have high profit margins. Neurofeedback has very low profit margins. There's no strong industry there, and so it really doesn't have the money to fund studies itself.
Okay.
Many of the studies that are happening with clinicians who are also, or university researchers who are interested in this area that are just ginning up funding from nowhere.
Okay.
And it's actually quite interesting. There's a guy named Bessel van der Kolk who works heavily in the area of trauma. He's at Harvard. He's an MD who became quite convinced that neurofeedback should be done on people who have trauma issues. And he's taken a pretty strong stance in this domain. Now, here's someone from Harvard who has gotten massive amounts of grant money to fund many research projects over the years, and he's actually trying to crowdfund a study on neurofeedback.
Good.
Which is neat, but it also sort of tells you it's still very hard to get money from government and other funding sources to study this intervention.
Sure.
So I wish we knew the answer to that question. It's a great question. We really don't know the answer, unfortunately. We know with methylphenidate and in ADHD, right, in neurofeedback, we know that the changes appear to be comparable. But that's the only study I'm aware of that has pitched head-to-head two different types of treatment with neurofeedback.
Yeah. Well, I think it shows that that they are definitely looking at the proof there. It is this working, and finding out that it is. So,
and you know, in the end, so research is really important. One of the things that we end up talking with our clients about, because we do remap kids to watch those changes happening, that really the reason you're doing these treatments is to change your child's life and to make their life better. And that is really the ultimate outcome variable. When you see your child, they start to have a tantrum and they get over it in 2 minutes instead of 25 minutes, it's huge.
Yes.
Right?
Yes,
So
exactly.
that as an outcome variable is probably, from a parent's perspective, way more important than some little number in some study. I know for me as a clinician, because I've been around a long time, when I added neurofeedback to my practice, so I'd been doing all kinds of services for over 30 years, and when I added neurofeedback to my practice, to see changes in people's lives that I had not been able to get any other way was just so compelling. I just could not believe it. And it was so exciting to see that, and that's one of the reasons I did the training and added neurofeedback to my practice.
Yeah.
So I do want to say that neurofeedback is an unregulated field in Idaho, so anybody could get a hold of equipment and do it. So there is a let the buyer beware in this state. You need to do the research on your neurofeedback practitioner. There is a voluntary certifying agency called BCIA, Biofeedback Certification International Alliance. You can go to bcia.org and see if someone has become board certified in neurofeedback. You definitely want to ask them what their training is, how many people they've seen, what kind of system they use. Are they doing whole head training or just putting on 1 or 2 electrodes? You really have to be careful. When you have unregulated fields, it can be good and bad, and so you want to be a smart consumer about that.
That makes sense. It sounds like it's probably not paid for then either by Optum or...
So
I'm guessing.
to my knowledge, no insurance in Idaho is reimbursing for neurofeedback right now.
No insurance.
So some people have been successful with Katie Beckett funds paying for neurofeedback, but it's generally out of pocket. And it's hard to talk about money because different people charge different things, and it depends on how fancy of equipment they have and how powerful of neurofeedback they do. But I would say that most people get in somewhere between $2,000 and $6,000. It can go higher than that if you have very complex, difficult disorders to do a round of neurofeedback. So there are upfront costs to this. I always think of it as like braces, insurance doesn't reimburse for braces, and we find a way to get our kids braces if they need them. But it can be a significant expense for people.
Yeah, so up to $6,000 for the whole round, but a shorter round might be
sometimes
less.
more. So
sometimes more.
So people do ask, how much is this going to cost me, and how many sessions is it going to take? It's a very good. You should ask that question.
I knew the answer to that one. Sorry, I should have. I know you need to come 2 or 3 times a week. Is that correct? For an hour?
We have people in my practice. We have people come twice a week. It takes half an hour to 45 minutes. The actual training is 20 to 22 minutes. That's what they found as being most efficacious. The rest of it is getting the cap on and chatting and hooking all the equipment
feeling
up.
Comfortable with each
Yes. The reason we train twice a week is because all the neurofeedback research has been done on twice a week training, almost all of it. So that holds fidelity to the research. So if the research trained people twice a week and we train people twice a week, we think that will get at least the same results. Our equipment now, at least in my practice, is more sophisticated and powerful than what's been done in most of the older research. So we feel like that really optimizes outcomes for people. But again, that has not been researched. However, there has been one study now done with once-a-week training, with this more powerful training we can do now, that looked at, did kids with ADHD make progress on once-a-week training? And that study found out that they did.
That they did. Okay.
But
good.
that is one study with
On
one type of training
and one problem.
on one problem. So, this is a very good question. I would say clinically what people see is that if people train once a week, they do make progress, but it is slower. That's probably what most people would say they observe clinically.
Yeah.
You can do intensive training. Again, that's considered experimental, so where you train once a day or twice a day for 2 weeks,
I've heard of
something
that
like
too.
that. Yeah. And I'll tell you my clinical read on that is that some people can make good progress with that, and some people get so fatigued because remember, you are working your brain out. So what happens in neurofeedback is, and they have fMRI studies to show this, is that it's very much like physical therapy or like exercise. So we are telling certain parts of the brain that are not used to activating to activate. And we are telling other parts of the brain to atrophy because they're too activated. And when you do that, your brain actually activates, and then just like in exercise, you need that rest time for it to recuperate. So at night, the neurons that have been used actually grow, and you can see that the little dendrites are growing just like a little tree inside the brain. And that part of the brain is getting bigger and more active. And the other parts go away. So if you train too much, you actually can overtrain and you get more and more tired and you've spent money and it hasn't done you any good.
Yeah, that's the problem. Yeah.
So just like with exercise, some people can work out 4 or 5 days a week and they're fine, but other people cannot do that.
You have to work up to 2 a day.
Right.
Yeah, that makes sense.
Yeah, and we don't have a way of predicting that right now, so we just kind of have to try it and see how the person does.
How many weeks are they doing that program then?
For intensive training?
Yeah,
It
or not
depends.
intensive, but the
regular.
Yeah.
So most of the studies have been done with 20 to 30 sessions.
Okay.
But I will tell you that that's less than most people need in the real world. And the reason is that when you're in a study, you don't get sessions done on you until you get well. You get 30 sessions, because everybody gets 30 sessions because they want to hold that constant in the study to make sure they get the research findings. So you will see improvement, and you'll say, wow, this person did 30 sessions and they improved. But you're not just looking for improvement usually with your child, you're looking for them to be better. So many of our people go 40 to 60 sessions. If you have very complex issues, you might go more than that. If you're a fast responder, you might go less than that. I've had some people that have done 5 sessions and gotten better. It's very unusual. I've had other people do 70 sessions and they got better, but other people who came through the door very much like that person did 40 sessions and got better. So how do you optimize your response to neurofeedback? The same way you optimize your response to physical therapy or exercise. You eat well, you get plenty of sleep.
Sure.
Because those neurons are part of your body and they're affected by your diet and your sleep and your stress and all these other things. However, the reality is, if you have a disorder, that's part of the problem. You can't sleep well.
You can't.
And you're usually not eating well. And any of us who have had kids know that getting them to eat all those vegetables is very hard. So we have this interplay, whereas the brain becomes more regulated, people start to sleep better. And there's actually very interesting studies on sleep and neurofeedback, where simple insomnia sleep disorders can often be treated in between 10 to 20 sessions of neurofeedback and people start to sleep. So oftentimes kids come in, they're eating very poorly, they're eating, sugar and carbs, but over
because
time...
they're trying to fix that.
They're trying to fix their brain, right? But over time, as their brain becomes more regulated, they start to sleep better, and then you have this kind of positive effect going on where everything starts to improve.
So do you recommend that parents allow some choice in that, or should they come in and really regulate that child?
It depends. It depends on the kid, right? Yeah, we've all, some kids it would cause more disturbance than help if you try to work on their, other kids are more open to that. We have found oftentimes if we work with them on that, it's more helpful than if parents work on it, because any of us that are parents know you get that sort of, I call it, the parents are poison syndrome. You say something to your child as a parent, and another person says it, and they're like, oh, well, of course I'll do that. But you say it, and they won't do it. So
that's right.
We generally work with all our clients on that.
Is your practice integrated with nutritionists or any other type of?
So we actually, in my practice, we have a list of foods that are foods that have shown in the research to be helpful to the brain.
Okay.
And so we talk with our clients about that. If kids have eating issues, as a psychologist, that's one area where I can help, sort of the psychological piece of that. We do have a nutritionist who is a separate provider that is half a block down from us, and we do refer to that person if we need to. Yeah.
Okay.
But I think it's a very interesting piece of the puzzle. Yeah.
Yeah, definitely. Well,
what other questions do you
I
have?
keep track of my.
I think we have. How are we doing on time-wise? We can be done.
I want to talk a little bit about resistance that you're going to see, because I know I'm thinking my own 2 children that are very resistant and breaking through, and they breaking through and going to therapies is hard for them, and they have a list in their brain. Oh, I have to do this, 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 and this, and you pick one because I'm not going to go to all of them. What would you pick if you were having to choose between a handful of things that they could go and do? Would you pick neurofeedback, or would you say, okay, let's look at this child, what is the priority?
Well, I would certainly say let's look at this child, what is the priority. It's hard for me, after seeing what neurofeedback can do, to think that there are some situations where I would choose other modalities prior to neurofeedback. And there are some situations where I wouldn't do neurofeedback, and we probably don't have all the time to get
Yeah.
into that. But it's another thing you want to talk with your neurofeedback person about, because not everyone is a good candidate for neurofeedback. But I think those decisions really need to be made on an individual basis. For me, having your brain better regulated is always a positive. And with many of our kids, we see some of these most egregious symptoms go away.
Yeah.
And it's hard. I have asked other therapists, well, how long do you think you'd have to do therapy in order to get that symptom to go away, doing talk therapy or behavioral interventions or things like that? Because I'm always interested in their feedback on that. And, mostly they say a long time, way longer than what it took for neurofeedback, which is why we do it, right?
Yeah.
You don't want to just go spend a bunch of money if you can get that same result in 10 sessions of talk therapy that your insurance is going to pay for.
It's going to pay for it, yeah.
So many of our people that come through our door are people that are coming through our door because they've failed all other treatments. Talk therapy hasn't worked, medications haven't worked, or they're on so many medications they're a zombie and they want to get off them.
That's probably not where you want to see them. You'd probably like to see them sooner. But
Well, I'm glad to see them when they
Yeah.
come through the door like that, because it does offer hope. And when
Yeah.
you are at the end of the line like that and something works, it is just so, so wonderful.
Yeah.
I can't even tell you what that feeling is about. One quick thing I did want to mention is we can do remote training with neurofeedback, so it is possible to actually have some neurofeedback equipment if you're in a remote area, have it in your home, and we can either run sessions over the internet or you can run sessions independently and send us the results. They're not as fancy as what we can do in the office, but if you're in a remote area or for some other reason your kid can't get through the door, it's often a helpful place to start.
very helpful.
So,
I had one other question.
okay.
Medication. You talked a little bit about medication. Do kids, imagine they're coming in, starting it, if they're taking medication and staying on that medication, do they titrate off of it eventually? How does that work?
Yeah, so as the brain goes towards normal, we have parents work with the medication provider to reduce the medication. Some people want to just say, well, we're just going to stop here and leave them on their medication. We're happy with that. Most people, their goal is to get their child off medication. And so as their medication goes down a little bit, we continue to train, reduce medication again, continue to train, and then eventually many people come off their medications.
Okay.
That's a really good question.
Yeah.
Because, medication is an issue for many families. And for a lot of the kids, they don't want to be on medication long term. So the idea of weaning them off.
Well,
as
getting
it
rid
goes
of those
through.
side effects, plus we don't know the long-term effects of many of these medications our kids are on, and our kids that are on cocktails, none of those have been studied. So we don't know what the combinations of these medications really do to the body. So a lot of people are quite motivated to do treatments that are non-medication alternatives.
Yeah, I know when we talk about things that are studied and proven, that medication has to follow the same protocols.
Right.
So and you're saying, and then we hear that a lot is that they don't really know 100% what to put your child on until they've gone through, and watched and see what their response is. So that can take, in and of itself, can take a long time.
Yeah.
So
I have just a couple quick questions. One I was wondering about, because like with ADHD, anxiety, and depression, that's kind of something that just stays with you every day throughout the day. What about for children who, like, there are triggers? They may be doing fine and then something happens, be it just a sequence of events that, occur, whether somebody coming into their house, a loud noise or something like that, or a dog kind of growling at them that is a quick trigger. Does the feedback work for that in terms of regulating the brain, and so the triggers aren't quite they're not as responsive, reactive to triggers?
So there's a couple things we see in that, and one is that kids who have very active sensory areas of the brain, so things are registering more strongly. So if I touch you, it's really your sensory encoding of that is like I hit you. And so when you calm those parts of the brain down, kids aren't as reactive to those things. And a lot of kids have sensory issues, and neurofeedback can be very helpful in calming that down. So that's one thing where you can handle this, this, and this, but once you get to that fourth thing, sensory issue, it just sends you over the top.
Right.
The other thing that we commonly see is the limbic system, which is the emotional centers of the brain, are hyperactivated. So let's say if this is, see if I can do this where you guys can see me without the mic. If this is kind of the normal range of functioning, and this is the part where you lose it, if you're writing down here, a lot of stress can happen and it just still pushes you up here. You're still in the normal range. But if you're writing up here, so to the rest of us, you look just like you're normal, which you are, but it doesn't take that much to push you over the top. And all of us who are parents know what that feels like. But some of us are like that every day. And so it actually looks like there's a trigger, and there is. But what's really happening is your brain is hyperactivated all the time. And so as you calm that part of the brain down, that's what we often see as hyperactivation in that limbic system. And this is what happens in trauma also. As you calm that part of the brain down, those triggers don't trigger you.
Because you have a larger capacity to deal with whatever the trigger had been.
Your set point has become lower.
So what about the other direction, the hypo, where they depressed and they can't get out of bed, and they, is it helpful for that too, where they're...
So depression has a different brain pattern. So in depression and anxiety, in some anxiety disorders, I don't know if you want me to get into all this, you often see the right side of the brain hyperactivated compared to the left side. So you activate that left side, which is the approach part of the brain, and people start to feel better. But the brain is complicated, and these are, I'm giving you very simplistic
simplistic answers.
Simplistic explanations, but neurofeedback does work very well with depression disorders. So you can actually make people too stable with neurofeedback, and people in the research industry talk about this. Well, if your client gets too stable, I'm like, no, we've never had anyone ever complain about being too stable.
Interesting. So outside of mental health, tell me about like traumatic brain injury and concussions. Because I know we previously had the discussion. I have a child who, through soccer, has had multiple concussions. And is there some research showing that this is effective in working with those type of clients?
So neurofeedback should be one of the first things you do if you have a head injury or a stroke. If you go on YouTube and type in head injury neurofeedback or TBI neurofeedback, you'll see all sorts of great videos on that. It's quite efficacious. There's a study being done right now with the NFL and neurofeedback, trying to rehab some of these NFL players who have become so impaired. The suicide rate's just astronomical with these guys. Some other very interesting things about neurofeedback is it's also a peak performance training. So there's a lot of CEOs in India that are all doing neurofeedback to bring their brain up to its optimal functioning. And so Olympic athletes do neurofeedback. It's a very, because it is really about regulating your brain to be optimal. There's all kinds of applications to this that are very exciting.
Wow. So for anybody that has questions, how can they follow up with you?
So you are welcome to call me at 208-867-4048, 867-4048, or you can contact me by email at drbminton, DRBMINTON @gmail.com. Okay. And I suppose they can get a hold of you, and you can...
They can come through me, and we will, yes, and we can definitely connect you to Dr. Minton. And take advantage, because I think this is enough to give people information that it creates a lot of questions.
Yes.
When you're looking at your particular child and kind of what's going on in your family, and is this something that would be a value as far as a new type of intervention? So, yeah, the more information, the better.
Okay.
Thank you very much. Linda, I really appreciate your coming, because it just adds that element of, kind of bringing it down, having the parent discussion. I think it's a really valuable addition to how we're doing this. So thank you for taking the time and joining us. And I mean, what a wealth of information. It's not anything I knew about, so I feel like, I know enough to be able to kind of ask questions or send people your direction so they can get some information. So please join us next month. We have Dr. Roger Olson from St. Luke's, who is going to be speaking, I believe, on early childhood mental health. I haven't gotten that nailed down. This is going to be an interesting one because it is going to be broadcast nationally. Our National Federation of Children's Mental Health is going to be picking this one up, and it's going to be broadcast kind of through multiple channels. So we're pretty excited that Idaho has had the opportunity, and they've asked us to do that. And so Dr. Olson will be presenting. So when we will see you the first Thursday of October. That's going to come by pretty quickly. So again, good morning. Thank you for joining us, and thanks for coming, ladies.
Thanks.
Thank you.